It's 3 in the morning. You're lying in bed, staring at the ceiling, counting the hours until the alarm goes off. You turn to one side, then to the other. You got up to use the bathroom, came back, and sleep won't come. And right when your mind finally starts to switch off, a cramp in your calf makes you jump out of bed crying out. You massage it, walk barefoot through the dark room, wait for it to pass. When you finally manage to fall asleep again, the alarm rings. Another day starting exhausted, with that heavy head, that feeling that you slept but didn't rest. If you're over 60 and this scene feels familiar, stay with me in this video. Because what I'm about to tell you in the next few minutes can change your nights forever. And the solution is simpler and cheaper than you imagine. I'm Dr. Kevin Vries. In over 15 years working with patients over 60, I've seen this same story repeat itself thousands of times in my practice. People who have been taking sleeping pills for years and still wake up tired. People who stretch their leg in bed thinking it will solve the cramp. People who drink warm milk, make chamomile tea, who avoid coffee after 2 in the afternoon, and nothing works. Sleep stays bad, cramps keep waking them up in the middle of the night, and the exhaustion piles up like a debt that's never paid. And the reason none of that solves anything is the same reason no one tells you in a 5-minute consultation. There's a simple, cheap mineral that costs less than a cup of coffee a day that regulates both your sleep and your cramps. And the majority of people over 60 have a chronic deficiency in this mineral without even suspecting it. The name of that mineral is magnesium. And here's a fact that will surprise you. Recent studies published in journals like Nutrients and the Journal of the American Geriatric Society show that more than 70% of people over 60 have magnesium intake below the recommended level. This isn't a rare deficiency, it's a silent epidemic. And the worst part is that it disguises itself as what we call old age stuff. Chronic fatigue? It's the age. Insomnia? After 60, everyone sleeps badly. Nighttime cramps? It's part of aging. Resistant high blood pressure? Age. Frequent headaches? Stress. None of that is normal. All of that may have the same common root. Your body is asking for magnesium, and you're not listening. As we age, 3 things happen at the same time. First, our gut absorbs less magnesium from food. Second, our kidneys eliminate more magnesium in urine. And third, common medications at this age, mainly diuretics for blood pressure, omeprazole for reflux, and some diabetes medications, deplete our reserves even further. It's a perfect storm. And the cruelest symptom of this deficiency is exactly what robs your rest at night. So what do most people do when they start sleeping badly? They go to the GP, describe the insomnia, and walk out with a prescription for zolpidem or some benzodiazepine, like clonazepam. Those drugs work to knock you out, but they don't give you restorative sleep. You sleep, but you sleep a shallow sleep, without deep REM phase, without real cellular regeneration. You wake up more tired than if you hadn't slept. And worse, after months of use, your body becomes dependent. You stop the drug, and the insomnia comes back twice as hard. For cramps, the recommendation I hear most is, eat a banana before bed. It has potassium. Look, banana is great, but if the problem were just potassium, it would have disappeared already. Most nighttime cramps in people over 60 isn't a lack of potassium, it's a lack of magnesium. Because magnesium is the mineral that makes your muscle relax after contraction. Without enough magnesium, the muscle locks, contracts, and can't release. That's where the cramp that pulls you out of bed comes from. Taking a drug that masks the symptom without fixing the cause is like covering the warning light on your car's dashboard with black tape. The problem is still there underneath, growing. Here's a detail almost no one notices. Magnesium is not just a mineral for muscles, like many people learn. It is the electrical regulator of your entire body. Picture it this way. Think of your body as a modern smartphone. The battery is the energy that comes from your food, from carbs, from fats. But for that battery to deliver electricity to the components of the phone, it needs what we in IT call a hardware driver, a regulator that controls voltage, that distributes the right current to each part. Without that driver, even with a full battery, the phone freezes or shuts down on its own. Magnesium is exactly that driver in your body. It participates in over 300 enzymatic reactions. Without enough magnesium, your nerves fire wrong signals, your muscles lock or twitch for no reason, your heart beats out of rhythm, and most importantly, stay with me on this point, your brain can't produce GABA, which is the neurotransmitter that calms neural activity and lets you fall asleep. That means without magnesium, even when you're tired, your brain stays in a state of chemical alertness, on, processing, ruminating. You close your eyes, but your mind doesn't switch off. Thought after thought. And this isn't anxiety from your personality, as many think. This is mineral deficiency. Magnesium also regulates the rhythm of your cortisol, the stress hormone. In deficiency, cortisol stays high at night when it should be low. Result: you wake up at 3, 4 in the morning, unable to fall back asleep, with your heart beating slightly faster, sweating lightly. This is not a coincidence. This is chemistry. It's cortisol firing at the wrong time. Now comes the part that matters: how to actually fix this. And here's the first thing you need to understand. Not every magnesium works. There are dozens of forms of magnesium for sale at pharmacies and supplement stores, and most either don't absorb properly or have a nasty side effect. Magnesium oxide, the cheapest and most common in pharmacies, has an absorption rate below 4%. That means you take a 500 milligram tablet and your body uses about 20, practically nothing. Magnesium citrate absorbs better, but has a strong laxative effect. If you take the dose needed to fix sleep, you'll spend the night in the bathroom. Doesn't work. The form that the most recent science points to as ideal for people over 60 who want to sleep better is magnesium bisglycinate, also written as bisglycinate of magnesium or glycinate of magnesium. It has 3 huge advantages. First, very high absorption, above 80%, because the magnesium is bound to an amino acid called glycine, which carries it straight into the cell. Second, zero laxative effect. You can take the full therapeutic dose with no fear at all. And third, and this is the most beautiful part, the glycine that carries the magnesium is itself a natural calming agent. It acts on brain receptors, promoting relaxation and deep sleep. That is, in a single powder, you're taking 2 sleep agents at the same time: the magnesium that calms the nervous system and the glycine that deepens REM sleep. It's no coincidence that clinical studies show significant improvement in sleep quality within 3 to 4 weeks of continuous bisglycinate use. Before I explain exactly how to take it, do one quick thing for me. If this video has been helping you understand something no one explained to you before, click the subscribe button right below. That's what allows me to keep bringing serious, science-based information without pushing you stuff that doesn't work. Subscribing is free and helps me a lot. You can rewind the video now, because what comes next is the practical part that can change your night starting this week. Let's get to the practice. The recommended dose of magnesium bisglycinate for adults over 60 with sleep and cramp problems is between 200 and 400 milligrams of elemental magnesium per night. Pay attention to that word, elemental. Look carefully at the product label, because some brands sell 1 gram of the compound, but the elemental magnesium inside may be only 130 milligrams. I usually guide my patients to start with 300 milligrams of elemental magnesium, taken between 30 and 60 minutes before bed. You dissolve the powder in half a glass of warm water, or in warm tea. Chamomile, lemon balm, valerian work well. Or you can mix it with a spoon of honey. Don't take it with coffee, because caffeine impairs absorption. Don't take it with a big meal, because the calcium and iron from food compete with magnesium in the gut. Ideal is to take it on a nearly empty stomach, before brushing your teeth, before going to bed. I had a patient, a 68-year-old lady I treated, who had been taking zolpidem every night for 7 years, slept 4 or 5 hours at most, woke up shattered, and had leg cramps 2 or 3 times a week in the early hours. She started with 300 milligrams of magnesium bisglycinate powder, dissolved in lemon balm tea before bed. In the first week, she had already reduced the zolpidem by half, in conversation with the doctor who prescribed it. By the 3rd week, she was sleeping 7 hours straight. In 2 months, she stopped the medication completely, with supervision, and the cramps simply disappeared. She told me a sentence that stuck with me. "Doctor, I had forgotten what it was like to wake up rested." And that's why I speak about this topic with such conviction. I see this often in my practice. The effect isn't magical, isn't instant. You'll feel a difference in the first week, but the full effect comes in 3 to 4 weeks, when your cellular magnesium reserves are completely replenished. You need patience, and you need to take it every day. And to amplify the effect, there's what I call the multiplier trio. Magnesium bisglycinate alone already works very well, but if you want the complete result, add 2 allies. First ally, vitamin B6, around 25 to 50 milligrams a day. B6 is a mandatory cofactor for magnesium to enter the cell and work properly. Without enough B6, part of the magnesium you take simply isn't used. Many good brands of magnesium bisglycinate already come with added B6 in the formula. Check the label. Second ally, pure glycine or tryptophan. Extra glycine, around 1 to 3 grams before bed, intensifies the calming effect and deepens the REM phase even further. Tryptophan is the amino acid that turns into serotonin and melatonin inside the body. Either one, along with magnesium, completes the trio. And here's the bonus no one tells you. When you correct magnesium deficiency, you don't just improve sleep and cramps. You also better stabilize blood pressure. Several studies show drops of 5 to 10 millimeters of mercury in the pressure of people who were deficient. Reduce chronic joint pain in those with osteoarthritis, because magnesium is a natural anti-inflammatory. Decrease feelings of anxiety and chest palpitations. Improve insulin sensitivity, helping those who are pre-diabetic. And reduce headaches, particularly migraines in those who have suffered for years. It's not Y, it's X. It's not a sleep supplement. It's a mineral that fixes several things at once, because it participates in so many reactions in the body that correcting the deficiency has a domino effect. Now, some important warnings, because I have a responsibility when I speak to you. Magnesium is a safe supplement for the vast majority of people, but there are 3 situations where you need to talk to your doctor before starting. First situation, if you have chronic kidney disease at any stage. The kidneys are responsible for eliminating excess magnesium from the body, and in kidney failure, the mineral can build up and do harm. Don't take it on your own. Second, if you use medication for cardiac arrhythmia, like digoxin or potassium-sparing diuretics, magnesium can interact and amplify effects. Third, if you take antibiotics from the tetracycline or quinolone group, magnesium can interfere with the absorption of the antibiotic, so take them at separate times, at least 2 hours apart. For everyone, the rule is, start with the lower dose, 200 milligrams, observe how your body responds for a week, and if all goes well, move up to 300 or 400. I left in the description below a link to a magnesium bisglycinate powder that I personally recommend, with the right dose, no unnecessary additives, with B6 already built into the formula. If you'd like to take a look, just click the link right there below the video. But the most important thing isn't the specific brand, it's to start. Look, I wanted to close this video by telling you something important. Sleep is not a luxury. Sleep is not something you can learn to live with little of. Sleep is the foundation of everything, of your memory, your mood, your immunity, your ability to react to a scare on the street, your patience with the grandchildren, your heart health, your libido, your balance when you stand up from a chair. When you sleep badly for years, you're not just tired, you're aging 5 times faster on the inside. And the worst is the look of resignation I see in many patients at the first appointment. Doctor, it's my age, that's just how it is. It is not. It's not normal to wake up 3 times a night with a leg cramp. It's not normal to count sheep at 4 in the morning. It's not normal to wake up more tired than when you went to bed. There's a cause, and in most cases, it's simple and cheap to fix. Magnesium bisglycinate is one of the most underused tools in medicine today for restoring sleep quality in people over 60. If this video opened your eyes, do 3 things for me. First, tell me in the comments below if you suffer from insomnia or nighttime cramps, and how long it's been bothering you. I read all the comments, and that helps me make more videos about what you need. Second, if you haven't subscribed to the channel yet, hit that red button below. Third, send this video to someone in your family or circle of friends who you know has been sleeping badly for years. It could be the most useful thing you do for that person all week. I'm Dr. Kevin Vries, and as I always say at the end of every video, take good care of yourself.